You may have heard the expression, no pain, no gain. Although effective for motivation, it isn't as good advice as you might think. You always risk injury when performing exercises that involve heavy lifting and physical exertion. However, some people put themselves at increased risk due to overuse. Overuse injuries are one of the more common types of injuries you will find when you're training. The old mantra of push through the pain may be true to an extent, but this mindset can become very dangerous when you don't know when to stop. People who typically push past this often suffer these type of injuries. An overuse injury is damage to a bone, muscle, ligament, or tendon caused by repetitive stress without allowing time for the body to heal. These can include injuries such as shin splints or runner's knee, or they can be more serious, such as ligament and muscle tears. These types of injuries occur when you don't give your body enough time to recover between workouts. The stress builds up over time until you end up hurting yourself. Overuse injuries are classified into 4 stages: pain in the affected area after physical activity, pain during physical activity not restricting performance, pain during physical activity restricting performance, and chronic persistent pain even at rest. Overuse injuries are extremely prevalent in young athletes. Nearly half of all sport medicine injuries in children and teens are overuse injuries. Children are playing organized competitive sports now more than ever, and therefore suffer the consequences because their bodies are not fully adapted to overcome the stress put on their bodies in certain sports. For instance, if a child is playing baseball and in order to keep up with competition, throws every day, he will end up with more elbow and shoulder damage than someone who plays a variety of sports, however not at the same level. In addition, younger athletes who haven't learned the proper mechanics and are training with this intensity can put themselves at an increased risk of developing these serious injuries. Some tips to help against these types of injuries include maintaining a good fitness level both during the season and the off-season. To be in peak physical condition, thus decreasing the chance of an injury due to not being conditioned properly to handle the sport. Giving yourself an adequate amount of time to rest. Working on one particular muscle group each day can not only increase your chance of injury, it can also cause your progress to slow down. When we exercise, our muscles tear slightly. These are called micro tears. This is why your muscles are usually sore after a hard workout. Once the muscles get these small tears, they recruit more muscle fibers to come and cover the tears, resulting in increased muscle mass, thus increasing your strength and size. However, not giving your body enough time to add these additional muscle fibers onto the tears can actually stop your muscles from growing. If your goal is to build more muscle, and you are only working your chest, but you're hitting it every day, you actually won't build any muscle at all and will increase your chance of getting injured. An adequate amount of rest is usually between 24 to 48 hours. However, these can vary based on your fitness goals and overall workout plan. Children should be limited to participating in a sport 5 times a week. They should take at least 1 day off per week and step away from the sport altogether for a combined 3 months out of the year. Be inclusive. If you are playing a sport as a child, you should focus on a variety of sports. Specializing at a young age can often lead to burnout. Childhood superstars often become injured due to overtraining in just one sport. Wait until you're older to specialize and focus on becoming more athletic and raising your fitness level so that when you do end up choosing a sport, you'll be in good condition to play at the best of your ability. Lastly, another issue of overtraining is burnout. This can be both a psychological and physiological issue. Especially in young kids, intensifying their focus on a single sport often reduces their enjoyment, which will make them not want to do it anymore. These often come with personality changes, such as lack of enthusiasm and fatigue. There is also a physical component to it. Just like with overuse injuries, this type of overtraining in young children can lead to chronic muscle or joint pain, elevated heart rate, and difficulty performing drills and exercises they used to be able to do. In order to prevent this from happening, you should keep the workouts interesting as well as allow them to take time off in order to keep them engaged. We always seem to think that working harder is the answer. While this is true to an extent, you should really be striving to work smarter. Know your body, but also know its limits. If you can find that balance, you should be able to avoid these types of injuries while also seeing the progress you want.